Hi everyone, I'm Wahenya Dog. In this video, I'm going to discuss croup. If you like this video and benefit from it, hit the like button, comment below, share, and subscribe. What is croup? Croup is an infection of the respiratory tract, primarily affecting children between 6 months to 3 years. Croup is also called laryngotracheitis, and it is also called laryngotracheobronchitis. This means that croup affect the larynx, that is the voice box of the baby, the trachea, that is also the windpipe, and also in severe cases it might affect the bronchus. The most common cause of croup is a virus we call parainfluenza virus type 1, type 2, and type 3. 80% of the cases of the croup are caused by this type of virus. Viral infection usually starts from the nasal membranes and spread to the larynx, then to the trachea, and it can end up going to the bronchus. This viral infection will lead to inflammation. Most of you have heard me mentioning the word inflammation in most of my videos. Inflammation simply means, or inflammation comprises of swelling, pain, and redness. This is how your body responds to infection or injury. In this diagram, I'm going to show you the parts of the airway that are affected by this disease we are calling croup or laryngotracheitis. We have the larynx. This is the larynx or your voice box. We also have the trachea. This is the windpipe, and we also have the bronchus. In severe cases, croup can affect the bronchus. What happens is that when you get an infection by the parainfluenza virus, this infection will affect or infect the larynx, the trachea, and the bronchus, leading to inflammation. This inflammation will lead to swelling. When there is swelling, the diameter of the larynx, the trachea, and the bronchus will reduce. This will make airflow difficult to enter into your larynx and down into the lungs. This one will result to what we call croup. What are the signs and symptoms of croup? Most of the time, croup begin as a common cold. So the child or your baby will experience non-specific symptoms like sneezing and running nose. Those are the non-specific signs and symptoms of the common cold. Then after 1 to 2 days, your child will develop the specific signs and symptoms of croup. These specific signs and symptoms of croup include: one, we have hoarseness of the voice. Number two, there is what we call back coughing. Your child will be coughing like the cough will sound like that cough, that sound of a seal, or like a dog which is barking. Number three, your child will have what we call inspiratory stridor. Inspiratory means breathing in or inhalation. Inspiratory stridor is a loud, harsh, high-pitched musical sound that occur when you are breathing in. It is produced by the turbulence flow of air when air is trying to enter the partially obstructed airway. This is because we have said that when you get an infection, the infection will lead to inflammation. The inflammation will comprise of swelling. When there is swelling, there will be a reduction in the diameter of the larynx and the trachea. This will reduce the airway, and in children, the the narrowest part of the airway, usually anatomically, is the larynx and the trachea. So if there is swelling, this the already narrow part will worsen, and air will be struggling to enter through into the larynx, creating that sound we are calling inspiratory stridor. Think of inspiratory stridor as that loud, harsh, whistling sound that comes from exhaust pipes of those matatus or those madhiri that ply Embakasi and Buruburu route or Rungai route. There is that whistling sound that is very harsh, that is very loud. They produce. This is the same as an inspiratory stridor. And last, on the further sign and symptom, your child will also have what we call labored breathing. Labored breathing comprises of tachypnea. Tachypnea is increased rate of breathing. Normally, a child can breathe up to 18 breaths per minute, but in this case, your child will be breathing very fast, more than 40 breaths per minute. Then we have what we call flaring of the nose. Flaring of the nose is the widening of the nostril when the child is trying to breathe in. I'm sure maybe you have watched a cow, or most of the animals, they usually try to widen their nostrils. And last one, we have lower chest wall in drawing. Lower chest wall in drawing is the sinking of the between the ribs of the child. That part, that area, you will see the tissues or the skin is trying to sink in between the two ribs because the child has labored breathing. What causes croup? Croup is caused by viruses. Most of the cases of the croup are due to viruses. Parainfluenza 1 or parainfluenza type 1, type 2, type 3 contribute or are responsible for 80% of the croup cases. The rest of the viruses that can cause croup, we have influenza virus, we have adenovirus, we have coronavirus, we have rhinoviruses that cause common cold, and we also have what we call the respiratory syncytial virus, or it's abbreviated as RSV. Then bacteria like mycoplasma and diphtheria can also cause croup. Historically, cases of croup were caused by diphtheria. Thanks to the vaccine or diphtheria vaccine, now we don't have cases of croup that are caused by diphtheria. For those people who are born yesterday, make sure that you take your children for vaccination to prevent such cases of croup. How does parainfluenza virus get transmitted? An infected child will cough or sneeze into the air. These air droplets will contain viral particles. These viral particles might fall on a surface, maybe the surface of structures or furniture or toys. Then when your child breathe in or touch those infected or contaminated surfaces, and also go ahead to touch either their eyes, their nose, and their mouth, they will get the croup infection. After they get the croup infection, they might experience common cold after a duration of a few days. Then this will also add up into what we are calling the croup. How is croup treated? Croup is treated depending on the severity of the croup. Your doc will diagnose you croup clinically. Clinically means that they will take the four signs and symptoms. Those four signs and the four signs and symptoms are a hallmark of diagnosis. Number two, your dog will examine the child throat, and also your dog will also listen the chest of the child with a stethoscope. Treatment of a mild to moderate croup can be can be done in an outpatient setup, and the child will be discharged home. Treatment of a severe croup is a bit complicated. Severe croup can lead to death through asphyxia. This is because there is an obstruction of the airway. An obstruction of the airway can cause the death of a child in a matter of 1 day. So severe croup is regarded as an emergency, and a child should be taken to hospital as soon as possible, and care taken. Follow and subscribe on your dog to watch more videos like this. Thank you.